I would like to ask organizers to have the pictures of all our presenters for a brief discussion. Of course, we are behind the schedule and we'll have to wrap this up soon, but I would like to see all your faces. Thanks for being with us. Thanks for participating in the discussion. Thank you for your interesting presentations. We got a lot of information, a lot of food for thought. We have new horizons opening up before us. I would like to ask Olga Golubnitskaya because she knows more about literary data in this field, and she is head of this famous journal, lots of publications in what the field of medicine 3P concept is more realized and where we can expect more breakthroughs. Thank you, Natalia. Well, that was a wonderful conference. I enjoyed every presentation. Well, everyone speaks in unison. And of course, what I am glad in particular is that your symposium draws up a line under what I'm going to say right now. There are no separate fields of medicine where we expect a breakthrough. The main breakthrough in medicine is that all the best specialists in particular fields draw the conclusion that reactive medicine is the medicine of the past. Right now, what is most important is to move to the proactive phase of treating our patients and to pool our efforts. An example regarding biomarkers. A lot has been said about my biomarkers today, many statements, but the key to the solution is multi-level diagnosis. Why? Well, let me give you an example, like two girls, two ladies with the vascular dystony. One can have the aggressive breast cancer detected later of the non-genetic form, triple-negative breast cancer, but the other lady has, well, the normal pressure glaucoma, or the so-called NTG, normotensive glaucoma, but dystony occurs in both cases. That means there should be other biomarkers involved that must we have a need for multi-level diagnosis. And again, today there was another important statement about coenzyme Q10 as far as generics are concerned. That's also important. I'm glad that a lot of attention was paid at this event to mitochondrial health, and coenzyme Q10 is linked to it. There were studies carried out in Germany. They showed that 90% of the German population suffers from the shortage of coenzyme Q10, and the rest 10% from a severe shortage, catastrophic shortage of coenzyme Q10. That's why we have all these problems with systemic diseases such as, well, diabetic retinopathy, AMD, and of course, glaucoma. As for your question, well, where the global world is moving to, where the breakthrough is going to take place, in a small Slovakia, well, they came up with the solution to build, and the work is already underway to build a huge 3P medical center for international cooperation in cooperation in such fields as eye diseases, well, prevention, prediction of oncological diseases, different forms of cancer, even aesthetic medicine. Right now, they pay a lot of attention to this field, that the population is aging and aesthetic medicine is becoming on the forefront because people are ready to pay money for such services. Why? Because when you're talking to great specialists in this field, to Corifei, to past masters who are involved in this area, they say that right now, at this point, it is impossible to identify what kind of scar we're going to have, whether the patient will be ready with the scar after the surgery or not. Also, mitochondrial health is the pivotal aspect of prediction and prevention in aesthetic medicine and in treatment of eye diseases. So here is another example how important it is to use a systemic approach to what all diseases mentioned here. We are preparing a publication at APMA, well, saying that myopia is a risk for the development of glaucoma. Myopia is linked to different systemic effects. For example, it was shown that patients with myopia has the higher level of fear. That's a psychological factor. And of course, here there is a need to have the support of psychologists and even psychiatrists. In this case, such people have a different metabolic profile in blood. And also, they have a totally changed profile of a microbiome. And here, it's not quite clear what was first, chicken or egg. And the changes in the profile of metabolites and microbiome, well, they are worse. The situation of vice versa, they improve it. And in speaking of predisposition of patients with myopia to glaucoma, we should seriously consider all these concomitant factors. Once again, I would like to express my gratitude. I was glad to see all of you, and my heartfelt congratulations on the occasion of this wonderful conference. I'll be glad to consider new projects with you for the APMA journal. Thank you for your comment. It was very interesting. Dmitry, any questions for our presenters?
Just a quick question to Dr. Chen regarding your system for identify uncertainties in differentiating of images. What should we do with these images which the system identify as uncertain? Should we use them for second round of learning or something, anything else?
Yeah, that's very good question. So firstly we identify the image with high uncertainty. So then we will read the image again by the investigator and see whether they have some problem of the labeling. Is it mislabeled for as another disease, or is it have some different feature from the training set? So if it is a mislabeling, then we will correct the label, and if it is have some different feature from the training set, then we will include this image in the second round of training. Then we will have a expanded spectrum of the disease. So then we'll have the better representation of the training set, and then I think that will have better generalization. Thank you.
Thank you. Thank you so much. Can I ask another quick question to Dr. Wang? Dr. Wang? Unfortunately, the image is frozen. Тогда могу я Светлане Георгиевне очень короткий вопрос.
Then a question for Svetlana, a brief question for Svetlana. Svetlana, what is your view? If we do injections in a lesser number of times, will it be better for patients with glaucoma because we reduce the probability of increasing the IOP during injections? There will be a lesser number of peaks, or it doesn't matter? Thanks for this question, Dmitry. I believe that The priority is the disease that we treat. If there is a need to do an injection, we should do the injections using the mode of the number of injections for this patient. But as for the peaks of IOP, we can compensate it by using our favorite drug, dorzolamib, in order to reduce the intraocular pressure, especially the post-operative period. The number of patients with glaucoma who were subjected to surgery is not that large, but there are articles on that. Thank you very much, all the speakers. Now I would like to ask our technical organizers to show the final slide.